Yes, Kiran Kaur. Yeah, we are going to do session today. Very special session. So Hello and welcome to Seven Sentinels. This is Grandmasterclass, and I am Peter Simon with you. Today we are conducting a speaking session workshop. We're going to learn how to speak, what to speak, when to speak, why to speak, everything about poetry speaking. Yeah. So number one, who are the participants? Deepika, Chandigarh, Kiran, Delhi. So we are going to, number one is participants, live participants. Live session participants. Okay. Number one, Kiran Kaur, Kiran Delhi. Number one is Kiran Delhi. Number two is Deepika Chandigarh. Number two is Deepika Chandigarh. Deepika Chandigarh. And number three is, number three is Habibullahi Sane. Number three is Habibullahi Sane. Yeah, right. So very good. Welcome to this today's episode. We are going to do a wonderful practice session. It's a very, very important. Yeah. Yeah. Now here is our speaking card. Okay. So this is the card. Right. So select. Yeah. Copy image. Yes. Okay. This is the speaking card. Yes. Swati Nemade. Yeah. Number four. Swati Nemade. Yes, all of you are going to get one speaking session each today. Yeah, that's very good. So I have noted down your names here. So I'll be calling you and giving you personal sessions. So prepare this card. Just think about what the sentences we are going to speak. Yes. Suppose this is you are a nurse or you are a doctor. Think that this is a doctor's card if you are a doctor. Think that you are a nurse. That's enough. You are going to learn the styles of presentation. Yeah. Yes. So now let us start like this one. What do you think? How do you think you are going to start the speaking session? If you are a doctor or if you are a nurse, how are you going to start this speaking session? Yes. Yeah, start. So how are you going to start this speaking session? Okay, commence the speaking session, begin the speaking session or introduction. How will you introduce? Introduction part. Yeah, yes, introduction part. How will you start? If I am a doctor or if I am a nurse, how will I start this introduction? Yeah, don't say hello, hi. Avoid those words. Avoid saying hello, hi, because those are informal. Yeah, this is a pre-surgery clinic. The patient is already there in the clinic. Okay, and you know the problem and everything. Yeah, imagine your situation, whether you know the patient or you do not know the patient, anything, known patient or unknown patient, whatever it is for you. Maybe it is known to another nurse, but it is unknown for you. Okay, anything it may be. Yes, come on. For example, if I am there, I will say like this. So, good morning. Okay, good morning. So, you know the name of the patient or you don't know the patient. Anyway, it's okay. Good morning. Yeah, this is one. Or I will say good afternoon if it is afternoon. Or good evening if it is good evening. Or a good night if it is night. Or good day if it is a day. Anything. So one of these five things I will be using. Good morning, good afternoon, good evening, good night, or good day. Anything I'll be using in that pattern. Yeah, right. Then, so here, now already this is, the person is there, the patient is there, or I think what next? Then they will say, okay, patient will say, this is nurse. Patient will say, okay, good evening, nurse, or whatever it is. Then what are you going to do? Yes. What are the next sentences that you may be using? Okay. Yeah. Good morning. Please have a seat. No, please have your seat. Okay. My name is Kiran. I am one of the registered nurses working in this clinic. Good. And I am the assigned nurse to take care of you today. Very good. Okay. Then I am nurse Sani Habibullahi, in charge of pre-surgery clinic. My name is Deepika. Your assigned nurse. I am your assigned nurse for today. My name is Deepika and I am your assigned nurse for today. Like that you have to speak, Deepika. Next step. Okay. Now, come on, give your sentences. Yeah. Next. Okay. Now, when you said like this, I am Dr. Swati. I am one of the treating doctors in this clinic. How can I help you today? That's good. Different sentences we are getting. Okay, very good. Next, what do you think the patient's answer will be? I'll give you that card also. What do you think? What are you expecting? What do you think the patient will, how do you think the patient will respond? What do you think the patient's response be? Okay. So you can say, what will the patient's response be? according to your opinion. Now, what do you think? What will the patient's response be according to you? Then, yeah, I'll show that card also. Yeah, this is the patient's card. Okay, this is the patient's card. Okay, copy image. Yeah, yeah, that's the patient's card. Now you imagine what will the patient say. Okay, now seeing this card, you have to imagine what will the patient say. Now you are the patient. Now the patient's role. The patient's role. Okay. Now what do you think the patient's response will be? Come on, think, guess what will the patient say? Because you are the manager here. You are going to manage the condition. Okay. Yeah, what do you think the patient speak? Come on, you design. So now there is another two students joined now. The two new students are Anita Pachigola and yeah, so Mira is the staff. Okay, Anita Pachigola. Yeah, nurse, where is my dessert? I have been waiting past hour. I'm very hungry. Doctor, I'm starving and I really want to eat something, otherwise I'll faint. My mom has brought a dessert. So can I have it now? Okay, come on. Come on. Give your own question and give your own answer. You will rule out. Nurse, I'm hungry. Can I eat my dessert? Good. Come on. Come on. Come on, all of you. Participate dynamically. This is going to be a dynamic session. The entire things I will take and I'll make it a PDF and I'll give you. Everyone's sentences you will get. Okay. Whatever you are typing in the chat box, everything I'll give you. Come on, nurses words. What is nurse going to speak? The same speaking session I am going to ask for everyone. Doctors are a different one, but of doctors practice. We are planning our speaking session. Yeah. Now, next one, the nurse. What is your response as a nurse? Telling, where is my dessert? I'm hungry. I want to eat. Please give me my dessert. So now the nurse, what are you doing as a nurse or a doctor? We just want to speak. That's all. Speaking is important. Nurse or doctor, put their aside. So you write as a doctor or you write as a nurse. That's no problem. Yeah. So what are you going to write? Nurse. Yeah. Here is the nurse card. Politely refuse the patient's requests. Okay, politely. You can use various words. Okay. You can say, I'm afraid. You can start like this. I'm afraid. I'm afraid. I'm afraid. So you can start like this. Or I'm sorry to say. I'm sorry to inform you. Use different styles. Uh, Please forgive me. Okay. Please forgive. I'm sorry to inform you. Please forgive me. Um, you are scheduled, actually scheduled for whatever you want to write. The yes, you're about to undergo an operation. Whatever you want to write. Nurse, I have 7 hours to undergo surgery. I'm literally feeling hungry and would like to have something before I faint. Yeah, good. I acknowledge your concerns. I'm sorry to say that you're not allowed to any food. 8 a.m. onwards. Yeah. How are you going to politely refuse? How are you going to politely refuse? Right. So write down your sentences here. A surgery has been scheduled. Okay. A surgery has been scheduled at a surgery has been scheduled at yeah, what is that you write there? Okay. So according to the standard protocol, for surgery. I'm giving you quality words, okay? According to the standard procedure or protocol for surgery, okay? According to the standard protocol for surgery, use these words. I'm giving you in bits and pieces, bits and pieces. Refraining from, or you are not supposed to eat anything from 8 a.m. onwards. Okay, refraining from, okay, refraining from eating anything is recommended. Okay. Or you can say, you are not supposed to eat anything from, okay. Or you can say like this, from, so my sentences. Yeah. You're not supposed to eat anything from so and so time. From 8 o'clock in the morning till the operation. You are not supposed to eat or drink anything it is one of the most important precautionary measures to avoid any unprecedented complications. It is one of the most important precautionary measures to avoid any unprecedented complications. Quality, quality, quality is that matters the most. Mind you, my sentences, write them down. Okay. You can use them as they are. Don't miss. You can use these sentences on any platform. Yeah. It is one of the most important precautionary measures to avoid any unprecedented complications. Compliance with the physician's recommendations. Compliance with the physician's recommendations would definitely be the best possible option for you at this juncture. Means at this condition, compliance with the physician's recommendations will definitely be the best possible option for you at this juncture. At this point of time, you have no other option but to follow the rules and regulations. in case you fail to follow this suggestion, in case you fail to follow this suggestion, the surgery will either be delayed or postponed to the next day. In case you fail to follow this suggestion, the surgery will either be delayed or postponed to the next day. Try to understand this. See the quality of sentences. Quality of sentences. Dalvi. Very good. Dalvi, learn these sentences. Note down my sentences, whatever I am writing in bold. Note down those sentences. You're not going to get these quality sentences on any other platform. So note down. These are spontaneous or instantaneous sentences according to the situation. I told you I'll give you sessions like this a number of times. So I'm started giving already. This week, this is the third speaking session we are discussing. Every other day, we are discussing either speaking or writing. So, then what else you can write? Dr. Swati, you can give your sentences. I expect more from you. Okay? Doctors can give quality sentences because you are studying a lot of books. You are reading a lot of books. So try to come out with it. No one is less. No one is more, but still. Yeah. Doctor, my name is not mentioned. Why not mentioned? No worries. I will mention it. Sukhwinder Kaur. Yeah. That's fine. I mentioned 4 names only so that other students will come to attend the session. Yeah. To motivate other students that these many students are attending. Right. Kiran, Deepika, Habibullah, Swati. Yes, Kiran, Delhi. Sukhwinder Kaur. Okay, why should I? Okay, I'll write your name also. I'm giving you 5. Sukhwinder. Yeah, come on, write down your sentences. I'll improvise. Sukhwinder Kaur. Yeah. Then next one is Dalvi Yogendra. Number 6. Yogendra Dalvi. Yeah. So politely refuse. How can you refuse politely? How are you going to send him? Write some. I'm so sorry to say. I'm sorry to say no. I'm sorry to say no. but you cannot eat or drink anything 6 hours before the procedure, and according to this protocol, you should be nil by mouth since 8 a.m. Very good. Good. Come on, write down like this. Accept my sincere apologies for rejecting your request. They come automatically. What did I say? 1 minute. Accept my sincere apologies for rejecting your request for having your breakfast. Accept my sincere apologies for rejecting your request for having your breakfast. That's it. You can write like this. Since your surgery has been scheduled, your surgery has been scheduled for, since your surgery has been scheduled for 2 p.m. and the protocol for precautionary measure, the protocol for surgery warrants, and the protocol for surgery warrants nil by mouth for 6 hours prior to the operation. Since your surgery has been scheduled for 2 p.m. and the protocol for surgery warrants nil by mouth for 6 hours prior to the operation. Okay. Okay. You are not supposed to eat or drink anything from 8 a.m. onwards until the operation. Since your surgery has been scheduled for 2 p.m. and the protocol for surgery warrants, okay, nil by mouth for 6 hours prior to the operation, you are not supposed to eat or drink anything from 8 a.m. onwards until the operation. The quality sentence is how. See the quality there. Okay. That's very important. So the same thing in passive voice. Okay. There's already most of the passive voice is there, but here you are not supposed to eat or drink anything. So eating, so here this sentence can be changed. Eating or drinking anything during this period is prohibited. Eating or drinking anything during this prohibited EAE period is prohibited. Yeah. compliance, strict compliance, or absolute compliance with the precautionary measures is expected. Deepika Chandigarh, yes, very good. You, Deepika Chandigarh, detrimental, no, detrimental. Okay, spelling mistake, but I appreciate your sentence. Really, I appreciate your whatever you are trying to do something. Yes, from becoming vulnerable, you are becoming strong and strong. This is probably not something that you were hoping to hear. My sincere apology. You're not supposed to have anything from mouth since 8 a.m. today. As a prerequisite of surgery preparation, you have to oblige for the same to avoid a detrimental consequence. So very good. I really appreciate. I really appreciate it. You're coming to the quality. There are some grammar mistakes, but don't bother. You have done well. It's 85% correct. And the quality is B plus. The quality is B plus. Definitely. If this lecture was not scheduled, you could not have prepared this sentence. I know that very clearly. If you had not participated in today's session, you could not have prepared this quality sentence. Definitely. You have risen in the quality. Yeah. Next. Now let us go to the next point. Yeah. So patient. Now what do you think the patient will talk? The patient. Now how the patient will respond? Yeah. How will the patient respond? Expected. Another word is anticipated. Instead of expected, you can also say anticipated. Now, what do you think the patient will tell? He's very angry. He's annoyed. He's reluctant to listen to you. He's adamant that he wants to eat something. What, nurse? What are you talking? Outright rejection of my request? That's not fair. I'm hungry. I'm hungry. You're telling me not to eat the dessert. My mother brought it with great love and affection. How dare you tell me not to eat? This is not fine. There is still a long wait before the operation commences. Why are you objecting me? Let me have my cake. It's okay. That's not a crime, right? For just one cake, one small dessert, it's not going to harm me, right? What's wrong if I eat the dessert? Why are you being so strict? Why are you being so strict? That's not right. I don't know whether I'm a good teacher or not, but there is a serial or there is a series called Good Doctor. Okay, go and watch this series, but don't get mad of it. Okay, go and watch that series. Don't become too much, you know, don't go deep into the things. You learn lot of English there. If you have time, will improve your language there. But don't be boggled with okay, a number of sentences which you can learn. Yeah. Dalvi Yogendra, I have watched season 1, sir. Okay, very good. Don't forget your OET and only read, watch Good Doctor. Okay, right. Yogendra Dalvi says, I have watched it. Very good. That's good. That means you are in the right track one way. Yeah. The name of the series, somebody type there. Netflix series. If you watch a Good Doctor too much, you will become a mad nurse or mad doctor. So don't watch too much. Yeah. So name of that one is a Good Doctor. Write down. Yeah. Yeah. That's fine. Good Doctor. Sir, how is he going to respond? The patient, come on. You are the patient now. What are you expecting to the patient now? You know how will he react? Because if you expect him, then only you can react according to him. So you should be ready to know how he is going to respond, so that you will be ready to react in the same way. You are rejecting his request, so you should know how he will react. Based on that one, your reaction will be afterwards. So be ready for that one. So you be ready to guess how the patient's reaction will be. Come on. Step into the shoes of the patient and react. It is not fair, nurse. Just one dessert. That one piece is not going to harm me. I am famished. I am famished. Why are you being so rude? My mother has brought it for me with great love and affection. I cannot wait to eat it. There is no harm in eating a piece of cake, is it? We still have a lot of time. before the operation. Yeah. Yes. So now the nurse. Nobody wrote, why are you not writing the nurse's role? I think just a small cup of dessert will not affect much. Yeah. Yeah, now the nurse or the doctor, now you speak. Yeah. Nurse, we should consider exceptions. Sometimes, not sometimes, sometimes. Nothing will happen to me. Take it easy. Yeah. Come on, now how are you going to speak as a nurse? This is the nurse. Now, another one. Second point, number 2. Okay. So, next third point, inquire about surgical procedure. Will I need a general or local anesthetic? So, general anesthesia. What do you mean? But that is not fair. I'm starving, and the operation still has a long way to start. Yep. Yeah, come on. How does the nurse react here? So, requirement general anesthetic. Yeah. Talk about the second point general anesthetic. The patient is asking, will I need a general or local anesthetic? Okay. So the nurse is telling general anesthetic. Yeah. How are you going to discuss this one? You have to explain everything. Why do you need a general anesthetic? Why not a local anesthetic? Okay. What is the reason behind it? Okay. Yeah. All the students' names I am noting down. Okay. So I'll take your speaking session, same speaking card. Every day I'm thinking of conducting a session and taking. So the same order. Okay. Only those students who participated in the session we can take. Yeah. So Anita Pachigola, number 1. Number 2, Dalvi Yogendra. So number 3, Deepika Chandigarh. Number 4. Habibullah is signing. Simiat Abdul Rahim. Simiat Abdul Rahim. Simiat Abdul Rahim from Nigeria and Habibullah Sarni from Nigeria. Both of you are from Nigeria, right? So from today onwards, you can practice 2 speaking sessions every day, if possible. Swati Nemade, wow, wonderful, 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 Swati, wonderful. According to the NHS guidelines, this procedure has to be undergone under general anesthesia. So we need to keep you starvated before surgery. Keep you starved or starvated. I'm not sure. Starved, I know, but starvated, I'm not sure. Okay, before surgery, because there is a risk of aspiration. According to risk-benefit ratio, better to be nil by mouth, though you think the procedure is only on the right shoulder, whatever body part, the. Very good, good. See, you can use like this. According to the NHS guidelines, very good. Swati Namade has given one style. According to the National Health Science, what is it? You can write the full form of NHS. Yeah. Very good. That's very good. So starvated. Just let me check whether the word is acceptable or not. Starvated is not there. Sorry. So you cannot use that word. Starved is there. Starvated is not right. Starved. Yeah, that is correct. Okay, starved means very hungry. Keep you very hungry. Starved is there. Starvated is not there. So don't use that. Okay. According to the risk benefit ratio. This also you can write. Okay. What is NHS? NHS. What is NHS actually? Full form. Can anybody type? Otherwise, let me check. National Health Service. Okay, fine. Okay, right. Let us take that one. According to the National Health Service guidelines. So you can use these words. Very, very excellent set of words. You'll become very powerful when you use these words. That means you'll get strong authority, power. Okay. For example, if I say, I am telling you this is not good, you'll not listen. According to the OET, according to the expectations of the OET, using the words moreover, furthermore, okay, or not recommended. So when I use the name of the OET, you'll become very strong, like that. If I say you will not listen, but if I take in the name of OET, then you will listen, like that one. Very good, Sukhvinder Kaur. Very good. People are coming up with quality sentences. Yes, I understand your situation that you're so into the food which is made by your mother. However, you can enjoy this food after the surgery because we have guidance to be kept. Nil per oral before any surgery, because therefore this is the reason that we insist to you not to take any food items. Very good. Very good. Okay. Yeah, you have brought in all the subject. That's very good. Yeah, in accordance with yes. So according to the National Health Service guidelines or in accordance with the National Health Service guidelines, both okay. And then according to the risk benefit ratio, that is another point. According to the risk dash benefit ratio, comma, yeah. This is also you can use according to the risk and benefit ratio. You can use like this also. Yeah. What is this NABH now? Anita Pajibola. Huh? New words I'm getting. Very good. Write in full, no NABH. Use full form. Don't write shortcuts. Use full form. You'll get 4 words and you'll be very strong and powerful. Yeah. NABH stands for National Accreditation Board for Hospitals. Yeah. And healthcare providers. Okay. That's very good. So we can write like this. According to the guidelines stated or formulated, very good sentences I am giving you. According to the guidelines formulated in the National Accreditation Board, accreditation. Accreditation Board. Okay. Accreditation. Yeah. ACCREDIT. Accreditation. Yeah. This is the word. The fact of being officially recognized, accepted, or approved of a very powerful word. Okay. Right. So, accreditation board for the hospitals and healthcare. Healthcare is one word. Providers, comma, yeah. So you can use this before telling some guidelines or rules. Whenever you are using some rules, you can use like this. According to the guidelines formulated in the National Accreditation Board for the hospitals and healthcare providers, that fellow will open his mouth and look at you like this. Ah, okay, madam. Oh, is that so important? They will get respect. They will give respect to you. Because you are talking with authority. Okay. So write this sentence style. Yeah. So because of that, now next one. Now next point, you can write about the importance of not eating prior to surgery, even though operation is not on the stomach. So this gives what are the reasons behind. Yeah, background reasons for rejection. Reasons for rejecting the request to eat. The reasons for rejecting the request to eat. Come on, the nurse. Yes, the nurse. Yes, reasons for rejecting the request to eat. Nurse, come on. Yeah, write down please. 10 members. One by one increasing. Kiran, Delhi. Very good. Yeah, come on. Explain the importance of not eating prior to surgery. Even though, what are the reasons? Come on, write down. So Anita Pachikola, Dalvi Yogendra, Deepika Chandigarh, Habibullah Sane, Kiran Delhi. Okay, once we finish this, we'll start speaking. Kiran Delhi and Simiyat Abdul Rahim. Oh, somebody's name is missed. Anita, Dalvi, Deepika, Kiran, Habibullah Simiyat, Srija Ravindran, and next number 8, Sukhwinder Kaur, and next one is Swati Nemade. Swati Nemade, you also can do the speaking, okay? Nurse is not there. You are one man army and you are in the clinic and you are nurse, you are doctor, you are compounder, you are everything. Only you are not the patient. That's all. So you have to play the role. Okay? All in one. Solo. So even though you are a doctor, you can do this. Don't worry. We are bothered only about speaking, right? Who is bothered whether it's a nurse or a doctor? We are not bothered about that. Yeah. Come on. Explain the importance. Why? Okay. Explore the reasons behind future to avoid future reasons behind avoiding the future complications, possibilities of some negative results, like yeah. Yes, please. Like, yeah, yeah, come on, write down. If you do like this every day, one session, you'll get a B plus or A. This was requested by one student actually. Very good, Nurse Habibullah. You're going to give me B plus. You'll definitely get B plus in the OET. Afterwards, you tell me after getting your result. During the surgical procedure, you will be administered anesthetic. Very wonderful sentence. I would love to read this sentence. During the surgical procedure, you will be administered passive voice anesthetic drug. They usually relax. Grammar mistakes are there, but still quality is awesome. Actually, if you do without grammar mistakes, you'll definitely get A grade. You will be administered anesthetic drugs. They usually relax the muscles, and due to their mode of action, all the body muscles will be affected. There will be a risk of vomiting and subsequently choking. Subsequently, it leads to choking. Very good. Srija Ravindran, medications used to induce anesthesia can cause a temporary blockage. Wow, very good, Srija. I did not expect this sentence from you. Okay, you have done. Okay, you have done a good job. Very good sentence, actually. Yeah. Of recluses which may lead to vomiting. Subsequently, the vomiters may enter the lung and cause only one lung. You have only one lung, may enter the lung. What do you mean by this? The lung? Huh? How can you say the lung? The lungs? The lungs? You cannot say the lung. You have two lungs, my dear. Human beings. By default, it's a mistake. Next one. Yeah. Yes. Come on, come on. Dalvi Yogendra, very good. Nurse, it's not just about stomach surgery, but if the surgery is on the other part of the body, we are still not allowing patients to eat or drink anything because the effects of anesthesia can cause vomiting, which can lead to aspiration. Very good. Very good, Dalvi. You're also coming with complex sentences with multiple complex paragraphs with multiple sentences. Very good. Very good. Okay, first attempt only you should get. You told no. I want to clear in the first attempt itself, sir. Yeah. You said I want to prepare first. What do you want to preparation 1 month for? Just to directly jump into action. Okay. Yeah, multiple sentences, complex paragraph. Very good. Excellent. We are coming to the last point now. Last point. Last point, yeah. Yeah, come on. Now discuss post-operative recovery. Several weeks to fully recover post-operative recovery. Pre-operative precautions, surgical options. There are, see how it is divided into three parts. First one is pre-operative precautionary measures. Pre-operative precautionary measures. Write down points. Pre-operative precautionary measures. Second one is while operation activities. While operation anesthesia. Pre-operative precautionary measures. Number one, while operation anesthesia and post-operative activities. Post-operative suggestions for post-operative management. So you can say post-operative management. So three different things you have done. Before operation, what you are supposed to do. During operation, what is given and why it is given. And last one is post-operative measure. What is it? How you have to take care of so that you will avoid any complications. Post-operative management. Pre-operative precautions. While operative treatment. While operative anesthesia. Reasons and results. Okay. And then last one is post-operative management. Yeah. Yes, come on. Simyat, eating is not allowed prior to the surgery due to the anesthetic drugs that will be administered. Wonderful sentence, not even a single mistake. Simyat, you are becoming perfect, you are achieving perfection in grammar. Eating is not allowed prior to the surgery due to anesthetic drugs that will be administered. Very good, excellent, 100% perfect sentence. All of you can copy this sentence. Okay. Right. This may cause the relaxation of muscles and increase. May future, na? May is future, so increases will not come. That is a mistake. This may cause the relaxation of muscles and increase the risk of vomiting. May increase, that is the meaning. May is common for both the parts. The risk of vomiting and choking. Very good sentence. Only one mistake, that is increases is wrong. Increase is right. Otherwise, everything is correct. Yeah. All of you can copy down this sentence. Just remove the S in increasing. Yeah, come on, come on. Discuss post-operative recovery management. Yeah, this is another one. Who wrote this one? Very nice. Even, who is this? Kiran. Wow. Kiran, is this you? Before undergoing anesthesia, it's important to follow. Useless fellow, you are so writing so nicely. Then why you do simple, silly mistakes? Huh? Kiran, are you crazy? Why do you panic then? So nicely sentences you are writing. Before undergoing anesthesia, it's important to follow fasting guidelines provided by your. Not even one mistake. Just simply ordinary sentences, you do silly mistakes. This helps prevent complications like aspiration, where stomach contents enter the lungs. Fasting reduces the risk as anesthesia can affect the protectiving reflexes. I did not get this one. That prevent aspiration. Always adhere to the specific instructions given by your healthcare provider regarding eating and drinking. Oh, Kiran, are these your sentences? I am doubting. Are these your sentences? Tell me frankly, did you prepare now or you already prepared and put? Did you write these sentences or did you copy anywhere? Copy anywhere means from your previous points. Prepared now, very good. Next time you are afraid. Sir, I'm afraid, sir. I'll take a stick and beat you. Useless, gooseberry. Prepared now, sir. Very good. Excellent. This is actually A grade quality sentence, but according to the mistakes, it comes B plus. Even if you do mistakes, no problem. Do extraordinary quality, and even if you do mistakes, you get B plus. Yeah, very good sentences. I'll give you these sentences. I'll put this one into a book and I'll give you. Yeah, come on. Post-operative recovery. So last point, post-operative recovery. Okay, nurse is going to talk about post-operative recovery. We're going to close the session in 5 minutes. Post-operative recovery and nurse. Yeah. Post-operative recovery. Yeah, fully recovered, swelling, stiffness, requires sling, counter, over-the-counter pain relievers, physiotherapy for exercise, all these things. We can talk about these things now. Can we take the same time every day for speaking? Can we take the same time for speaking session, planning or preparation every day? Give your vote. Yeah. Yeah. So 1 p.m. every day, 1 p.m. will start. Every day, 1 p.m. will start. One day medicine, one day nursing, one day medicine, one day nursing. But no problem, whatever it is. What's the problem? 1 p.m. every day. 1300 hours daily. Yeah. Remind me, Kiran, every day. Daily we'll take one speaking session. This is because of you people. Yeah. Come on, last point. Discuss post-operative recovery, several weeks to fully recovery, swelling, stiffness, may require a sling, over-the-counter pain relievers, physiotherapy for exercises, And whatever you think is important, you can write. You are educating. Now I'm going to provide you education regarding post-operative management for excellent recovery. So you can write like this. Finally, last point, you can say finally, I am now going to, somebody has already written. Very good. Srija Ravindran, very good. Yeah, I'm now going to educate you regarding the post-operative management for excellent recovery. Okay. So you can start the sentence like, finally, I'm now going to educate you regarding the post-operative management for excellent recovery. So like this, you can start and you can say anything else. Okay. So the sentences which I'm giving you, you can use in any question. Yeah, Nurse Habibullahi. I would like to discuss post-operative recovery events, which include several weeks to be fully recovered. There will be swelling and stiffness. You might require the use of a sling. Drugs will also be given for the relief of pain. And you will also need to visit the physiotherapist for physical therapies such as exercises. Very good. Right. Come on, come on. Concluding part. Yeah. Everyone started thinking very nicely. A lot of improvement is there. Rifa Tarannum, very good. Don't miss these sessions. So, Oh, sorry. Complete the last point. Fourth point, post-operative recovery. And those who have already done it, then you can say the conclusion. Conclusion. The conclusion. I strongly believe that I have explained you. I have discussed with you. I strongly believe that I have discussed with you all the about discussed with you regarding all the important things, all the important things regarding, okay, regarding firstly the preoperative, the preoperative, the preoperative precautionary measures, comma, while operation practices, medical practices, and the post-operative management. Post-operative management. So you can say like this. Yeah. In case if you still have, in case you require any additional information, in case you require any additional information, please do not hesitate to ask me or the doctor We are ready to explain you yeah, explain you Okay, right. Yes, provide the conclusion. Last. Yeah, yes, last 3 minutes. Last 3 minutes. Conclude. Yeah, Kiran, very good. Good, all of you. 2 minutes more. 2 minutes more. I'll make this PDF and send you. Yes, last 10 seconds. Anybody has anything, submit, because I'm closing the session. Okay, thank you all for active participation. Yes, submit all. 10, 9, 8, closing. 7, 6, 5, 4, 3, 2, 1. Submit. Finished. Yeah, closing. Copy. Yeah, it's come to how many pages? 11 pages, 12 pages.